What does my Q4 assessment consist of? In the ICU, we do Q4 head to toe assessments unless there's something otherwise that needs to be specifically done more often. So let me quickly share everything I assess every 4 hours. Let's start with neurostatus. GCS, brainstem reflexes, pupil size and reactiveness, grip strength, mobility, sensation, speech, orientation. Now let's do cardiac and pulmonary. Heart sounds, lung sounds, rate, rhythm, how regular a patient is breathing or irregular a patient's breathing, secretions, perfusion, pulses, gap refill, skin warmness or how cool the skin is. Now let's do GI, GU. Bowel sounds, abdominal palpation, bowel movement frequency, size, color, and consistency. Urinary output, urine color. If a female patient is on her menses, we will also assess for that as well. We also do a full body skin assessment at least once a shift, and then we reassess every 4 hours for any changes. So like any wounds, skin turgor, how dry or wet or whatever the skin is. If there's any wounds, we will take a close look at those. Also, we'll assess all my lines, tubes, and drains. So like central lines, peripheral lines, arterial lines, dialysis lines, dialysis sites, like if someone has a fistula, urinary catheters, JP drains, surgical drains, any sort of tube that comes in or out of your body, like NG tubes, rectal tubes, duo tubes. Okay, I think this is it. I'm sure I missed something somewhere in there, but you get the point. Head to toe assessment, we assess everything.